our first content video, the Humanopedia, we will be learning about the anesthesiologists. So really quickly, before we dive into anesthetics, who are anesthesiologists? Well, anesthesiologists are medical physicians who specialize in developing anesthetic plans and are involved in the administration of anesthetics. Anesthetics are specific substances that can cause an insensitivity to pain. In this quick video, we will go through the history of anesthetics and anesthesiologists. We will go into the role that anesthesiologists play in our lives currently, and also talk about a few different types of anesthesia. First, the history of anesthesiology. In 1799, a British chemist named Davy Humphrey was the first to suggest the idea of using nitrogen oxide as an anesthetic to numb pain. Later on, in 1824, an English physician named Henry Hill Hickman was the first to experiment with nitrogen oxide as an anesthetic. In 1842, an American physician and surgeon named Crawford Long was the first person to use sulfuric ether as an oral inhalable anesthetic on a patient. 3 years later, an American dentist named Horace Wells was the first person to use nitrous oxide in a dental operation. And later on in that same year, Crawford Long used ether as an anesthetic during child surgery for the first time. In 1846, W.T.G. Morton used ether in an operation again. 1847, Sir James Simpson performed childbirths using chloroform to ease pain. The local use of anesthesia began in 1848. Later on, in 1898, the use of spinal anesthesia had begun, but was not yet inducted into clinical practice until a later time in that same year. In the early 2000s, medical schools began offering formal training in anesthesia. The University of Florida was the first major university to start offering majors in anesthetics. In the 2000s, the study and administration of anesthetics became a separate branch of medical studies and education called anesthesiology. Now, the roles of anesthesiologists. There are various roles and responsibilities of anesthesiologists. For example, an anesthesiologist will take a medical assessment of the patient, and the physician anesthesiologist will make sure you are fit for surgery. They will ask you and your general surgeon about your health problems and issues that can affect the effect of the anesthetic. They will also examine you and run and receive many tests. This procedure is meant to create a safe environment and ensure a safe surgery for the patient. Anesthesiologists provide comfort for patients before, during, and after anesthesia. During surgery, the anesthesiologist manages pain control and closely monitors the patient's body to make sure there aren't any concerns or problems during the surgery. An anesthesiologist will also manage medical problems that spontaneously occur in surgery, as well as other chronic diseases the patient must have, such as asthma, diabetes, high blood pressure, and heart problems. Anesthesiologists will also decide if it's time for the patient to go home after the recovery or whether the patient will be needed to move to a different care unit. They will also create a recovery plan based on the patient's stage or recovery and vitals. Anesthesiologists monitor and control vital life functions before and after anesthesia, including heart rate, breathing, blood pressure, body temperature, and body fluid balance. Anesthesiologists are also required to deliver anesthesia and provide a diagnosis. There are 4 types of anesthesia: general anesthesia, monitored anesthesia, also known as IV sedation, regional sedation, and local anesthesia, which we will talk about more later in the video. Now we will talk about types of anesthetics. There are 4 types of anesthesia: general, monitored, regional, and local anesthesia. General anesthesia is when the patient is not awake and is unconscious. They have no awareness or sensation of what is happening around them. The general anesthesia can be given through gases or vapors or through IVs. An anesthesiologist who works with the patient to figure out what method works best based on the patient's health conditions. The most common side effect of general anesthesia is drowsiness, which tends to go away in 1 or 2 hours. Some common surgeries where general anesthesia is provided are knee replacement surgeries and open heart surgeries. Meanwhile, monitored anesthesia is given through an IV and can make the patient feel drowsy and relaxed. Based on the seriousness of the surgery, there will be different levels of sedation. For example, mild sedation is commonly used for eye surgery. This is when a patient is awake and can respond to questions or instructions. Or the patient could be in deep sedation, which is similar to general anesthesia, when the patient deeply sleeps but is able to breathe through the surgery. This is commonly used for colonoscopies and endoscopies. Regional anesthesia makes a specific area of the body numb to help control pain. It is given through a small injection called a catheter. There are two types of anesthesia, spinal and epidural. Spinal and epidural both are used for operations such as childbirth, orthopedic operations such as total knee and total hip replacement. However, an epidural anesthesia can be used to give pain control a few days after surgery. Local anesthesia is injected through a needle to numb a specific area. This medicine is often used during times when doctors need to sew up areas and for other dental purposes. Doctors may provide this type of anesthesia during recovery to help control pain relief. In conclusion, we know that anesthesia was first thought of in 1799 and was first used in 1845, and that the local beginning of anesthesia began in 1848. We know that anesthesiologists have to look at a person's vital life functions to make sure they are fit for surgery, and that they also have to look at a patient's medical history and check if they have any chronic diseases, such as heart disease, diabetes, asthma, and etc. We also know that there are four types of anesthesia: general, monitored, regional, and local anesthesia, and that each type of anesthesia is used for a specific type of surgery. Here are the links that we used for this slideshow, and if you would like to read a bit more in depth, then feel free to go ahead and visit these websites. Thank you for watching and listening to this video. Please make sure to subscribe and hit the bell icon for any notifications. Remember that we'll be posting a new video on our channel every Sunday. Thanks for watching again.